Libby McMillan's son, Grayson, is a healthy baby boy. But Libby had some trouble with her OB/GYN during his birth. Libby says she was happy with her physician during her prenatal visits, but when it came time to give birth, she found her doctor rude and unwilling to address her concerns.
And so I get to the hospital to be induced, and that morning, basically I get there and everything that we had talked about and planned for my induction kind of went out the window.
As a result, Libby says she's looking for a new physician.
Deciding to switch doctors is a decision a lot of people don't make easily because, let's face it, it's a really personal relationship. But in the last 2 years, 37% of Angie's List members reported they have switched doctors, and over half of them said that it was their decision. There are many reasons why patients might feel it's necessary to switch doctors, whether it's that they don't agree with the doctor's bedside manner, they don't agree with the treatment options, or it's hard to get a hold of their doctor or get scheduled. But bottom line is, if you don't feel comfortable with your doctor, it's time to move on.
There are steps patients should take before breaking up with their doctor.
If you are going to be switching doctors, the most important thing is to find your new doctor ahead of time, because it can be a little complicated, whether it's looking for someone who takes your insurance, who has openings, so you don't want to be left in a lurch without a doctor.
An Angie's List poll found nearly 70% of respondents did not explain to their former physician about why they were leaving.
Whether you decide to tell your existing doctor you're leaving or not is really up to you, but if you are comfortable, it can provide some really valuable feedback to that provider. If you do decide you want to let your doctor know why you're switching, you can either tell them in person yourself, tell them over the phone. If you're not comfortable doing that, consider an email. You can also give a review on them. It's a great way to be able to get that feedback to the provider.
The bottom line is that you are the paying customer and you need to be comfortable and happy with who your provider is. And you shouldn't let embarrassment about switching stop you from seeking out what's going to work best for you and your family.
When switching doctors, don't forget to have your medical records sent over to the new provider. And keep in mind, you may have to pay for copies. This is Deanna O'Donnell for News 46.